Hello everyone. Today we will discuss about postnatal growth of maxilla. Postnatal growth of maxilla occurs by displacement, growth at sutures and by surface remodeling. Displacement are of two types: primary displacement, secondary displacement. Primary displacement: maxilla is attached to the cranial base by means of number of sutures. It is a type of displacement which is seen when maxilla grows of its own and it will be formed in forward direction. Here, bone deposition occurs which will push the maxilla in downward direction and move anteriorly. So, maxilla move in a posterior direction due to growth in maxillary tuberosity which causes maxilla to move anteriorly. Now coming to secondary displacement. Secondary displacement is a passive displacement of maxilla. As the cranial base grows, it exerts pressure on the nasomaxillary complex, displacing it in downward and forward direction. So here is in cranial base, there is a bone deposition which exerts pressure on the nasomaxillary complex and displaces maxilla to move forward and downward direction. Now coming to growth of sutures. Whenever growth of sutures takes place, it leads to downward and forward displacement of maxillary complex. Some of the craniomaxillary sutures are frontonasal sutures, frontomaxillary suture, zygomatic maxillary suture, zygomatic-temporal suture, and pterygopalatine or mid-palatine suture. These all are the sutures of the craniomaxillary craniofacial base. Then coming to remodeling. In remodeling, resorption on lateral surface and deposition on external surfaces of orbital rim occurs, and this does lateral movement of eyeball. Surface deposition on superior, lateral and anterior surfaces of the floor of orbit. So there is a surface deposition occurs on superior, lateral and anterior surface of the floor of orbit. Deposition along the posterior aspect of maxillary tuberosity, जहाँ पे थर्ड मोलर accommodate करेगा. Resorption along lateral wall of nose, increase size of nasal cavity. Resorption along nasal wall of nose होगा जिसकी वजह से nasal cavity की size increase होगी. Resorption of anterior and deposition on posterior surface of zygomatic bone. Resorption होगा anterior surface पे and deposition होगा posterior surface पे zygomatic bone के. And there is a bone deposition occurs on the alveolar process where teeth will accommodate. And orbit follows V principle of growth. And you have to learn this also, that most of the floor and roof are depository. अगर गाइस वीडियो आपको पसंद आया हो, अगर टॉपिक समझ आया हो, तो लाइक, शेयर, सब्सक्राइब और कमेंट करना ना भूलें. थैंक यू एवरीवन.